If there was an emergency and you needed to save a life, would you know how, or would you be a helpless bystander? I'm certified in CPR from the American Heart Association, and today you will be learning the basic steps of cardiopulmonary resuscitation, or CPR. The first step is to make sure that the scene is safe for you and the victim. Also make sure you have personal protective equipment, which is gloves and a CPR mask. The first step is to gently shake the victim and try saying "sir" or "miss" loudly. Sir, can you hear me? Are you awake? If it doesn't work, you have to gently rub your knuckles across the sternum, which is the center of the chest. If they don't respond to either of these things, that means they are unresponsive to verbal and painful stimulus. If they don't respond, you need to call 911, and if they do respond, CPR is not necessary. The next step is to begin rescue breathing. Place 2 fingers on the forehead and on the bottom of the chin, and gently tilt the head backwards. And then put the head to the victim's mouth and look, listen, and feel. You look to see if you can see the chest moving up. You listen to see if you can feel breath, and hear if you can hear breath. Okay, then you'll put the CPR mask over their nose and over their mouth and do 2 breaths. Look to see if the chest moves up, and then do another breath. If neither of these things work, you need to begin chest compressions. You place the heel of your hand in the middle of the victim's chest, and then interlace your other hand with your hand. You need to compress the chest about 1.5 to 2 inches. And the chest needs to completely recoil before you begin another chest compression. You need to do 30 chest compressions, and then you begin your rescue breaths again, which are 2 rescue breaths. You perform 30 more chest compressions, and then, if that doesn't work, you recheck the victim for signs of breathing.
Oh,
He's awake! I have just saved somebody from a heart attack. Remember that it is always better to be properly trained by a CPR instructor and only through hands-on practice. Can you hope to learn all the steps in CPR? Today I have shown you how you can save a life with CPR. I hope that walking you through these steps made you a little bit more comfortable with performing CPR. Keep in mind that most instances of cardiac arrest happen in the home, so you may have to help a loved one in this situation. Once the heart stops breathing, brain death can occur in 4 to 6 minutes. If you perform CPR, it will provide oxygen to the brain and increase the chances that the individual will make a full recovery after EMS returns. If immediate CPR is given and a defibrillator is used within the first few minutes following the cardiac arrest, the person's survival rate doubles. Thank you for your time.